The controversy surrounding the current midwifery laws continues as the Midwifery Modernization Act reaches the Senate floor. New at 6, News 10's Taryn Fitzik shows us why OBGYNs are speaking out against the act, saying allowing midwives to become independent of physicians will put patient safety in jeopardy.
This is a step backwards in patient safety.
I see it as an absolute disaster for our women.
Currently, midwives must practice with a licensed OBGYN with insurance and sign a practice agreement. However, under the proposal, midwives would be declared independent professionals.
The answer can never be suboptimal care. If a patient is going in for a vaginal birth and there's no obstetrician as a backup, that patient within minutes could require an emergency C-section. And if you're in a rural area and there's no obstetrician, the patient and the baby could die.
It's too bad for the people of New York State that this bill has gotten as far as it has. We don't want this bill. If it does pass, women are going to suffer.
But midwives strongly disagree, saying there will still be a safety net if the unexpected were to occur.
If you're working in a hospital situation and you have an emergency, we in the hospital have healthcare providers that respond to those emergencies.
Midwives also make the point that signing an agreement doesn't make them better practitioners. They say the only thing that will change if the legislation becomes law is more choices for pregnant women.
I think it will really increase access of prenatal care and women's health care to women in rural areas, as well as women who seek midwifery type of care.
However, OBGYNs say while many of them do work closely with midwives in their own practices, taking away the written agreement is equivalent to gambling with a mother and her child's life.
Unfortunately, the way labor and delivery works, you can never predict when a low-risk pregnancy or patient turns into a high-risk situation.
Now, while there is clearly a strong debate from both sides of this issue, those in support of the Midwifery Modernization Act say similar legislation has been adopted in 17 other states and ask the question, why the same can't be done in New York as well. Taryn Fitzik, News 10.